So my name is Westreich. I'm a board certified allergist, currently working at ENT and Allergy Associates in Howard Beach, New York. I went to medical school at the University of Maryland, did my pediatrics residency at the University of Minnesota, and I finished my fellowship last summer at National Jewish Health in Denver in allergy immunology for both adults and peds. Sure. So there's quite a large percentage of the population does have some form of seasonal or year-round allergies. So it's approximately like 10 to 30%, depending on different studies. And the main symptoms of seasonal allergies are typically those that affect the nose. So that can include congestion, itchy and runny nose, sneezing. Allergies can also cause itchy and watery eyes. And for some people, it can also trigger their asthma. So that can cause shortness of breath and wheezing as well. Identifying allergy triggers, so that can be done in different ways. So one way is with skin prick testing, which can be done in an allergist office, or it can be done with blood tests. It's important because it can help direct how we manage and treat your symptoms. So if you know what you're allergic to, there are ways that you can avoid contact with the specific allergens that are causing you problems. There's also certain medications like oral antihistamines that can be helpful if your symptoms are due to allergies. And there's also other therapies that can be targeted to treat your specific allergies and desensitize you to them. So that's, examples of that are allergy shots or tablets. Yeah, so some useful tips during the pollen season is really trying to avoid or minimize your exposure to pollens. It's easier said than done. But some tips that can help are keeping your windows closed, particularly inside your car and your home, really to keep the pollens, outside instead of inside your home. Other things are like removing your clothing, showering as soon as you come inside, wearing a mask or sunglasses can also be helpful at times, especially if you're cutting your grass or gardening outside for a long period of time. Another thing is also, checking the pollen counts, which you can do. There's different ways to check that online. And that, you can consider staying indoors when the pollen counts are really high. So there are really many options available to treat your allergies. So many of those medications are available over the counter and can be effective when you use them regularly. Nasal saline sprays or rinses are ways to actually clean out the allergens from your nose. Nasal rinses are particularly effective at doing this. So those are available in squeeze bottles, neti pots, and other devices as well. So they can be used, they can be helpful when you use them daily as part of your routine, but also, when you use them as needed when your symptoms are more significant. Steroid nasal sprays are another option. So that's, Flonase is an example of that. And it's very effective at reducing the inflammation in your nose and particularly helpful at reducing congestion. These will have the greatest effect also when you use them daily during your allergy seasons. Oral antihistamines, so those are helpful at reducing itching, sneezing, and runny nose, but they're not as effective as the nasal sprays at treating congestion. So these are typically going to be used once daily, and examples of those are Zyrtec, Claritin, and loratadine, and those are good options because they're not as sedating as other antihistamines, and they are effective up to 24 hours. Another option, if those treatments are not effective, are antihistamine nasal sprays, and those can have a more immediate effect at improving congestion and can be very helpful for that. So if all of those are not working, then something that's important to consider is allergy immunotherapy, which is an effective way at actually treating the underlying allergies. So it accomplishes this by actually retraining your immune system to not be allergic anymore. And it's done by giving you small doses of the things you're allergic to, either in shots or tablets that you put underneath your tongue. And so many patients who are on these therapies, they'll have significant improvement of their symptoms, and they're able to reduce or stop the use of the other medications that we talked about. Seasonal allergies can be very disruptive in your life, but there are ways to achieve better control of your symptoms. So trying your best to minimize exposure to your allergies and consistent treatment with the nasal sprays, the nasal rinses, and antihistamines can help get your symptoms under control. And allergists can help you figure out what you're allergic to. that can help guide you on ways to avoid those allergens and also the best way to use your medications. And finally, if all of those things are not effective, allergy shots or tablets are also a great option at helping you treat your allergies and getting rid of them altogether.